frontrunner for Health and Human Services in the Biden administration was Rhode Island Governor Gina Raimondo, but she may have a problematic history, as Governor Raimondo approved huge health insurance premium increases, gave nursing homes legal immunity as the death toll sold. That's according to documents obtained there by the Daily Poster. And a point to note, yesterday she said that she won't be Biden's HHS pick. But friend of the show, editor-at-large for Jacobin, founder of the Daily Poster, David Sirota, joins me now to talk about HHS, that story, and more. It's good to see you, David. Thanks for joining us.
Good to see you. Thanks for having me.
Absolutely. David, let's lay out here who are some of the other contenders. So the Governor Raimondo ruled herself out, but who is ruled in, and what did her consideration tell us just about how Biden is thinking about the HHS position, an incredibly important agency in the federal government?
Well, what's been reported is that Vivek Murthy, the former Surgeon General, is potentially up for that job. Michelle Lujan, the governor of New Mexico. Gina Raimondo was, there was a trial balloon clearly sent up about her candidacy. And what it tells you is that the Biden administration, if that's true, that people looking at these cabinet selections aren't necessarily taking into account the potential downsides of some of these candidates. Now, of course, again, Raimondo now is ruling herself out. It's hard to know what's going on behind the scenes, but there was a 24-hour period where she was considered the top nominee. She was considered the top contender for that job. And then a lot of reporting came out, and then all of a sudden she's pulling herself out of the race. I don't know if that had anything to do, if one had to do with the other. But what I can tell you is that, as you said, she had Medicaid cuts in Rhode Island. Rhode Island has been one of the places where the COVID outbreak has been the worst and arguably the worst managed. We obtained documents showing that when healthcare lobbyists went to her and asked her for an executive order giving legal liability shields to nursing homes, she snapped to and did that immediately, even amid the death toll that was exploding in her state. Now, did those revelations end up harming her potential nomination? It's hard to know. But I do think it's true that moving forward into this confirmation battle, whoever the nominee is, if they were in a position of oversight during the COVID situation, they're going to be asked tough questions about whether they managed that situation properly.
Yeah, I think you're absolutely right there, David. And I guess this is the main question. What does all of this tell us about governance? Because, I saw this with the Neera Tanden thing. And look, the Neera Tanden thing, all the Bernie stuff aside, OMB is a very important agency, right? It runs a lot of stuff, regulates a lot of stuff. And when I see these types of trial balloons being floated around people who have terrible records, it just tells you this is a multi-billion-dollar agency. It's actually one of the largest agencies in the federal government in terms of their discretionary spending. It controls our whole healthcare system, the CMS, and all of that. What does it tell us just about how he's thinking about governance itself?
Well, I think one thing he may be looking for, if you believe the reporting that Raimondo was up for this and that Lujan was up for it, is that he may be looking for a governor or a former governor. And I do think in terms of administering a large bureaucracy, certainly being a governor of any state is a kind of experience that is germane to running a bureaucracy like HHS. But I do think you're right. This nomination for whoever is going to be HHS secretary, it is an enormously important position because it really is one of the most important federal agencies dealing quite directly with a public health crisis. What was shocking to me, honestly, in the floating of Gina Raimondo as a potential candidate was, how can a person like that even be in the conversation if they have been involved in presiding over one of the worst managed COVID outbreaks in the entire country? The question that I have is, how are you even in the conversation if that's the record that you're bringing to the table? Now, again, she pulled herself out of the contention, but the fact is that if you're in contention for a job like that, what does it say about what disqualifies somebody from being even in contention for these jobs?
No, I think you're very right in order to point that out. And we're going to keep a close eye on this, and we'll continue to highlight your reporting. David, thanks for joining us, man. Really appreciate it.
Thank you. Thanks for having me.
Absolutely. Coming up, I'm going to talk with Section 230 with our friend Rachel Bovard. That's when Rising continues.